Choose the inappropriate action of the healthcare provider while performing BLS. Option A. Determine consciousness. Option B. Open airway. Option C. Defibrillate. Option D. Auscultate for heart sound. The correct answer is option A. Auscultate for heart sound. What is the approximate hemoglobin in newborn at birth? Option A 10 to 12 gram per deciliter. Option B 14 gram per deciliter. Option C 15 to 20 gram per deciliter. Option D 21 to 25 gram per deciliter. The answer is option C 15 to 20 gram per deciliter. At birth the hemoglobin level is 13.5 to 24 gram per deciliter. Less than 1 month 10 to 20 gram per deciliter. 1 to 2 months 10 to 18 gram per deciliter. 2 to 6 months 9.5 to 14 gram per deciliter. 7 months to 2 years 10.5 to 13.5 gram per deciliter. 2 to 6 years 11.5 to 13.5 gram per deciliter. 6 to 12 years 11.5 to 15.5 gram per deciliter. Females 12 to 18 years 12 to 16 gram per deciliter. Females more than 18 years 12.1 to 15.1 gram per deciliter. In males 12 to 18 years 13 to 16 gram per deciliter. Males more than 18 years, the hemoglobin level is 13.6 to 17.7 gram per deciliter. In a postoperative patient, Staphylococcus aureus found normally on the skin can cause option A cold sore, option B pneumonia, option C wound infection, option D urinary tract infection. The correct answer is option C wound infection. Option A cold sore caused by herpes simplex virus. Option B pneumonia commonly caused by Streptococcus pneumoniae. Option D urinary tract infection caused by E. coli. Braden Scale is assessment tool used to predicting the severity of the option A brain damage, option B pressure ulcer, option C myocardial ischemia, option D cerebral ischemia. The correct answer is option B pressure ulcer. Braden Scale is the scoring system to evaluate a patient risk of developing pressure ulcer. Braden Scale developed in 1980 by nurse Barbara Braden and Nancy Bergstrom. It consists of 6 categories: sensory perception, moisture, activity, mobility, nutrition, and friction or shear. The maximum score of sensory perception, moisture, activity, mobility and nutrition is 4 and friction or shear is 3. So the maximum score of Braden Scale is 23. Minimum score is 6. Patient with Braden Scale score is 15 to 18 at mild risk to develop pressure ulcer, 13 to 14 at moderate risk, 10 to 12 at high risk, 9 or less at very high risk. Maximum storage life of platelet concentrate is option A 3 months, option B 2 weeks, option C 30 days, option D 3 days. The answer is option D 3 days. Platelets stored at 20 to 24 degrees Celsius and shelf life is 5 days. Whole blood stored at 1 to 6 degrees Celsius and shelf life is 21 to 35 days. Red blood cells stored at 1 to 6 degrees Celsius and shelf life is 42 days. Fresh frozen plasma stored at minus 65 degrees Celsius or cooler. Shelf life is 1 year. Cryoprecipitate stored at minus 20 degrees Celsius or cooler. Shelf life is 1 year. Plasma stored at minus 20 degrees Celsius or cooler. Shelf life is 1 year. What do you mean by pulse deficit? Option A, missing of a pulse in normal pulse rhythm. Option B, difference between systolic and diastolic blood pressure. Option C, difference between pulse in sitting and standing position. Option D, difference between apical and radial pulse. The correct answer is option D, difference between apical and radial pulse. Pulse pressure is difference between systolic and diastolic blood pressure. When a person infected with HIV, antibodies can be detectable in the blood. Option A, any time after the exposure. Option B, 48 hours after the exposure. Option C, 2 weeks after the exposure. Option D, 3 months after the exposure. The correct answer is option D, 3 months after exposure.